So good morning. Hi, my name is Patriece Thompson. I'm the Director of Investor Relations for the Allegheny Conference. Welcome. I'd like to thank you all for joining us this morning for our Response and Recovery webinar series. During these uncertain times, the Allegheny Conference is focused on understanding the needs of the Pittsburgh region and responding in real time with relevant information and resources to move forward together. Before we get to the panel, I want to thank our sponsors. Without this, it would not be possible. Peoples, Giant Eagle, Highmark, and UPMC Health Plan for their generous support, which allows us to bring this webinar to you today. And continuing the support from our 300 RIC members to support the work that we do every day. I am extremely anxious to hear from our experts. But for now, I'd like to just have a quick conversation. In the recent years, the Allegheny Conference has made progress on things such as criminal justice reform, the disproportionately impacted minorities. We've also been supporting efforts to improve the diversity of supply chain and corporate leadership roles. COVID-19 has led us to take a step back to make sure we focus on the right things. And when it comes to equity, as it relates to public health and economic opportunity, we take what we learned today and from our panel discussion and for our future webinars, being able to plan and have an action. So with that being said, it's a pleasure to welcome our guest presenters today. We have Julie Strickland-Gilliard, the Director of Western PA, Office of the Lieutenant Governor. We have Jessica Ruffin, Senior Leader of Equity and Inclusion at the Allegheny County Department of Human Services. We have Dr. Jamil Bey, President and CEO of the UrbanKind Institute. And you'll be hearing from each and every one of them individually, and then we'll open up the floor for questions, suggestions, and any other input that can help us with our discussion today to move forward with the recovery and to keep assisting and helping our region. Please feel free to submit questions and suggestions throughout the presentation with the Q&A tool. And we will address anything that we can with the time that we have. So first we will have Julie Strickland-Gilliard, Director of the Western PA Office of Lieutenant Governor John Fetterman. The Lieutenant Governor and his office are leading a new health disparity task force that aims to ensure that no one is left out of Pennsylvania's recovers for the COVID-19. Julie, thanks for joining us today. Could you talk a little about this new initiative?
Hi, thanks for having me.
Today with COVID?
Yeah, hi. Well, it's an honor to be here. I am personally very excited about the work that we're doing in the Lieutenant Governor's office and within this administration. As we all know, we're all Zooming, right? We are in the midst of COVID-19, and we are all concerned about how everyone's going to fare through this. One particular point that caught my attention, has caught many other people's attention, as well as the administration, is the disparities as it pertains to health, particularly with minorities, vulnerable populations. We've seen the data coming in from other states, as I'm sure most of you have. And unfortunately, African Americans are not faring well. And that should not come as a huge surprise to anyone. And the reason for that is these issues that we're seeing as a result of COVID-19, the infection rates, death rates, so on and so forth, the economic impact, what we're seeing are pre-existing conditions that have been exacerbated by COVID-19. And so we had these conversations within our office with the Lieutenant Governor, and the Lieutenant Governor also brought it up with Governor Wolf. And Governor Wolf agreed that we needed to have a new type of approach, not just for COVID-19 itself. Obviously, we need to prioritize that in the recovery effort. But there's also long-term issues that have been barriers, and definitely for the African-American community, as it relates to health access, as it pertains to education, jobs, wage, good wages. All those things are really important. And the purpose of this task force, one, I want to clarify, the task force is an internal task force within the administration. It is comprised of the Lieutenant Governor serving as chair. I am on the task force, as well as several other people in our office, Secretary Flood, members from the Department of Health Health Equity team. It's a long one. We have folks representing 5 commissions within the governor's office, including African American Affairs, Latino Affairs, LGBTQ Affairs. What I have been focused on as it pertains to my work, and I've been doing this work prior to the creation of the task force, is focusing on the African American community. The task force is not just the same voices in the room talking to each other, right? We're part of the administration. But part of what our role is now is to be the touch point for legislators, for constituents, for stakeholders that have solutions, that have great ideas. None of these issues are new to any of us, really. But what can we do that's different? And so this task force serves to compile all of those thoughts, the feedback, the voices. Really, at the end of the day, everybody is a part of the task force who wants to share with us, who wants to connect with us. And it also is on us to go out and connect with stakeholders and constituents, not ask everybody to come to us. They've been doing that in a variety of different ways for generations. And we really want to be proactive and take a proactive approach to addressing these issues and have a direct line to Governor Wolf. As far as how long the task force will run, we're not sure right now. What I can tell you is this task force is going to be huge in terms of long-term plans and really tackling head-on these systemic issues, and not have it be the data was in the news one day and everybody starts talking about it, right? And then in a month or 2 or 4 months down the line, that talk peters out. That can't happen anymore. The condition folks are living in and experiencing right now, I certainly wouldn't want anybody struggling to this degree. But sitting around and just talking for the sake of talking doesn't produce actual results. We can put Band-Aids on things, but that's not going to lead to, further opportunities for my peers, the people in my community, or my children's generation coming up. So we are in the infancy stages of this task force. It just started. We've had 2 meetings so far and have been doing a lot of work on various committees and so on and so forth. The other thing that I would want to mention about the task force, the state, there are a variety of different departments, as many of you know. We need a better way of connecting, not just regionally, but across the Commonwealth and throughout every department that is tackling issues pertaining to Black and brown people. We need to tackle our vulnerable communities by sharing that information, sharing feedback. We're all connecting with the community in a different way. We all have our own expertise. I am thrilled at the team that the governor put together to work on this task force. I have every confidence that this is a great team that's going to do the actual work to connect with people and prioritize their voices. So that's the main goal of the task force. I'm sure There are a variety of people watching this right now, and some of my fellow panelists that are going to be hearing from me. They're going to be hearing from other people on the task force. I am going to be chairing the policy committee it's an advisory committee for this task force, along with Secretary Flood and my colleague Steve McFarland, who lives out in Philly, and he's in our Philly office. But there's going to be a lot of work ahead of us, a lot of work for all of us. This is an all hands on deck situation. We need everybody coming together with their great ideas, with their energy, and everybody needs to be reaching out and making sure to prioritize the voices of those that are most vulnerable right now. It matters, language matters, talking about these issues matter, and I'm thrilled that this administration decided we're going to try something new.
Do you feel, Julie, that after having these task forces that are, now put in place, do you feel that that folks from your side of the table are now seeing the gaps and they're truly holding, I guess, themselves accountable of where the gaps are at? Could you maybe just tap a little bit on that?
Yeah, I think there was no way to avoid looking at this. And to be honest with you, at least in my lifetime, I've never seen anything like this. The impact on our community in every single sector across the board grabbed all of our attention. And when we turn our attention to what is our role in this, what is our duty in this, our duty is to protect the health and futures of every single human being residing in the Commonwealth of Pennsylvania. And we have to address that there were strategies, there's been strategies and, all along pertaining to communities of color, pertaining to the Black community, right? But we need to also address that there are things that haven't worked. If they had been working the way that they were designed with that end goal, I think we would see better outcomes in the Black community right now. So I think that everybody is doing a deep dive, and I'm glad to see them do that. And I'm glad to, speaking personally, as a Black woman, be able to sit at that table and share not just my professional experience and expertise, but my personal lived experience. I come from the nonprofit community. I worked in the community. I worked on startup initiatives, grassroots initiatives. These are the folks that we need to be talking to. That's the boots on the ground. It's the people that are impacted every single day. And we can read as many articles as we want or talk about it, but having those voices prioritized matters, and coming up with solutions that are not just feasible, but sustainable long-term.
And Julie, thank you for your candid comments. We'll circle back and, we'll have some more questions. I'd like to go to Jessica Ruffin.
Sure.
Morning, Jessica.
Good morning. Thank you so much for having me.
Yeah, I'd like to introduce Jessica Ruffin, Senior Leader of Equity and Inclusion with Allegheny County Department of Human Services. How are you doing this morning? How's COVID going for you?
That's a loaded question, but I'm doing all right this morning. But we're getting through this. I mean, I'm one of the fortunate folks that have the resources to be able to work from home and to have my child at home and being able to participate in school activities. And so, I tell people all the time I'm desperately missing, my family, my parents, my my grandparents are in their 80s, and we see them every week. And so to go 7-8 weeks without actually being able to see them and hug them is hard. But I also recognize that if that's the only thing I'm sad and worried about, then I am extremely blessed. And so, yeah, I think we're getting through this. Yeah.
So just can you touch a little bit about what the works and resources of what you're doing, for COVID, for our communities, and some of the effect that you're seeing that's going on as you're doing your work?
Sure, absolutely. So, I mean, as most people know, the county's Department of Human Services is actually the largest department within the county government. And we are tasked with meeting the human service needs of Allegheny County. And more often, we're seeing the county's most vulnerable residents. And so we administer everything from child welfare to the Area Agency on Aging, the supports for folks experiencing homelessness, to supporting folks that are struggling with drug and alcohol addictions. And so, and shortly before the governor declared a state of emergency, and we started to get our stay-at-home orders, the leadership team at DHS was really just thinking about how do we continue to offer these critical services to these very vulnerable communities as with as little disruption as possible. And so, I'm fortunate enough to say that, we have been able to do just that. I mean, we still have everything from child welfare investigations going on to check-ins with families. We have a great system going with making sure that seniors are getting meals delivered to them, and that folks are checking in on them in contact-free ways to keep them safe. We've made great provisions for those that are experiencing homelessness, making sure that folks are, what's safest for them, and also where they want to be. So we've done everything from making sure that some of the camps around the region have porta potties and have access to water and soap and things like that, all the way to making sure that we actually have a quarantine and isolation hotel here within the county for folks that can't safely quarantine or isolate themselves at home. And so I think I'm feeling very hopeful that we were able to do that. The second phase of that is really, we knew, and Julie kind of alluded to this, that there, even with all of our hard work and trying to build out an integrated program or integrated services, that there are still communities that are missed. And so, my team, as well as just a ton of teams around DHS, have been working diligently to make sure that we're getting information and resources into the hands of folks that need it the most, that might have gotten missed. And so, we have been working closely with a lot of our providers, as well as some of the other out of school time providers and schools. We were able to develop a food map that's interactive and updated in time, so that folks who do have access to the internet can go and see in real time where food distribution points are, working with our colleagues at the health department and making sure that they have the data and the resources that they need to make sound decision making. And I think one of the other things that I'm very proud of that DHS was able to do is, we operate through our very expansive network of providers. And so it became very clear that as guidance was coming in from the federal government or from the state, we needed to do all that we could to make sure that guidance got into the hands of our providers. And so what started out as a daily conversation with the providers, or daily calls, just to kind of make sure that they get access to that guidance, really did turn into kind of a regional launching pad. So, we recognized that the providers, yes, they needed the guidance, but they also needed to know more about what was happening for families. And so, we provide updates every day on everything from food to childcare initiatives to workforce development. We've had folks from the health department on the call. So we've done a great deal. And so I encourage folks that are listening today, if you'd like to know a little bit more, we've recorded those presentations are now down to 3 days a week. But if you want to know a little bit more about the guidance and things that are getting out there, they're on our Allegheny County Analytics website. So they're there for the listening or for reading the summaries. I think that they're extremely helpful. And then finally, and Julie alluded to this, there's never been a crisis or that has happened in this region where we have not had to rely on the benevolence of just everyday people, right? So it's everyone from organizations to individuals that just want to help out their neighbors, right? And so, we can't operate and do the things that we need to do without that benevolence. I mean, it's just the reality. We always have folks that are willing to fill the void and fill the gaps. And so, as recently as last week, we started to also host listening sessions with really the targeted approach of like, how do we make sure that we get critical information into the hands of people of color, and especially with special emphasis on our immigrant and refugee communities, because we knew that we were walking into a situation where there were a lot of barriers in place. And those listening sessions were extremely eye-opening. We have a lot of special initiatives underway right now, working very closely with leaders within the Latinx community and making sure that we're getting actually translated guidance onto their Facebook pages, working with, folks within refugee communities to develop a program where we're training leaders within those communities about COVID-19 and really how to advise folks within their community on what to do if they start to feel ill. So, I mean, it's been great. I mean, and now I think what we're starting to do is shift our attention to, what this talk is all about, recovery, right? So, I mean, we know that we're in a position where we're going to have to reopen at some point. I'm not going to even try to get into the jargon or rhetoric around when that's going to happen, but we are going to have to reopen. And we want to do so as safely as possible. And we know that the people that we are working so hard to resource and to support right now are the exact ones that are on the front line, are going to be the first ones called back to work, right? And so we want to make sure that when that does occur, that we're doing it in a way that's thoughtful, that is safe, and that people have what they need to be able to just be able to re-engage with the outside world again. Again, recognizing, and I'd be remiss to say that there are tons of folks that never had the luxury of working from home, right? And so it's also at the same time making sure that they have what they need to be able to just continue. And so I'm happy and I'm proud to be a part of those conversations. I'm happy to work for an agency that is doing amazing work to actually hear from providers about what it is that they actually need in order to be able to successfully either reopen or to continue their services. The last thing I will say is that, and I hope that we don't lose sight of this, I've been talking a lot about the lessons learned from COVID-19, right? And so I think that, most of these discussions start out with the negative, right? That, we have these huge gaps, our systems don't work for most people, and if we've learned anything about this pandemic is that, those issues have been exacerbated, and that we have to do what we need to do to make sure that we're filling those gaps and that we're doing all that we can to hold elected officials accountable, as well as making sure that the resources that are needed to fill those gaps are available. It's just heartbreaking every time I look and see I think even if we look at just like the digital divide, like the idea of kids working from home without equipment or internet or any of those things is just mind blowing. And these are things that we really need to be holding our institutions accountable for. And so that's definitely one of the lessons learned. The other big thing is that, and at least from the human services perspective, we've seen some awesome things happen remotely and through telephone. I mean, we've seen an increase in the amount of folks that are actually able to access behavioral health resources through the phone or through the internet. There are some school districts and some schools that are thriving working remotely, or kids are doing well working remotely. And so, in addition to, the negative lessons learned, I'm hoping that we are learning lessons about how we could do things and how we could make things more accessible and inclusive for everyone. And so I'm hoping that we hold on to those as well. And I'm excited to be working for an agency that's really trying to uplift those lessons and essentially change the way that we're doing business moving forward.
Thank you. It sounds like food security, childcare, workforce development. These are issues that are, they're constantly going to keep coming as we try to figure out what we're going to do to get through COVID. A quick question that I would like to just know is, what is a barrier that you feel, that you feel we're just not addressing? I know that internet and remote access for all children, that's just something that you think Pittsburgh we would have together and, figuring that out. But what is one barrier that you feel we're just not addressing yet?
I think that we actually need to do a better job getting culturally responsive information out into communities. And so I think we need to make sure that a blanket message is not going to work for everyone. We've seen through the COVID-19 response that as a result of the delay of our federal government to actually respond to this pandemic, that a lot of misinformation got into communities from the Black community. I mean, language that was circulating around social media, and I'm sure Dr. Bay will speak to this, but like saying that Black people can't get coronavirus or COVID-19. I mean, that resonated with people, and we cannot avoid that. And we did not have a counter message for folks. Culturally responsive also means that we're getting information out in folks' preferred languages. I mean, to have the immigrant and refugee population that we have in Western Pennsylvania and not have translated guidance, and also like specific guidance, like it's more than just, stay home. It's also, that also it's also saying to folks that also includes, parties and celebrations. And this is how I've not seen it. And granted, I am only proficient in English, and some days not even that. But I mean, I haven't seen guidance out there for, not to call out Pittsburgh Public Schools, but like even schools around like pickup of packets. I mean, there are ESL students in PPS. And so it's just like, how do you publicly get, information out to those families that maybe English is not the parents' primary language, but they also want their kids to be able to participate in schools. And again, I don't want to pick on PPS because I'm sure that this is a problem across all the districts, but I'm just citing what I'm seeing. And so I think that that's going to be a huge barrier that we've known existed, that we have to continue to work on, that we have to get things out and not just English. And we also need to make sure that the messaging is appropriate to the audience. And we have not done that well at all. And this is a call to do a better job.
And I think that's a great way to segue into Jamil. Dr. Jamil Bey, President and CEO of the UrbanKind Institute. Some thoughts on what we just kind of ended with. I would like to touch on the Black people who can't get COVID. Are you hearing some comments like that?
Well, I don't think we're hearing that anymore. Everyone knows someone with the disease, and lots of folks are dying. But let's make good morning. And I said, I was listening, and every time I'm around Jessica or hear Jessica talk, she's just a fountain of information about resources. And it's just like, you can't take notes fast enough because she speaks so quickly. It's just like all this good stuff that we need to be sharing and talking about. So it's always a pleasure to share that space with her. And Julie, hit on most of the talking points, from the Band-Aid approach that we've been taking about we don't want to go back to where we were before. And so much of what we need to be thinking about in a recovery. But as far as, your question directly about the messaging, we have committed to just developing some new narratives around this space and trying to hit those buttons where our messages can resonate just by working with folks in settings and in spaces where they can be ready to receive this information. One of the things that I want to make sure that we're talking about is we're thinking about a recovery. And, as Julie was saying, the governor is committed to talking about making sure that we don't have to be talking about this the next time we have this pandemic. And I think if we're going to do that, we need to really think about pandemics as natural hazards. They occur. Earthquakes, floods, tornadoes, these are natural hazards. And it's easier to think about how we mitigate earthquakes and tornadoes because we're thinking about physical infrastructure. But what we're talking about now, and especially when we look at these essential workers, this is the infrastructure for our economy. And we've not committed to making sure that it was resilient. And so we have folks who are absolutely essential that we need out there. And less than a year ago, we were arguing that these people should not be paid a living wage, and much less the sort of benefits that they need. So if we're going to make sure that our economy is resilient and that we don't have to shut down and talk about a year's long recovery, we need to make sure that those essential workers have what they need to be able to take care of their families and take care of themselves when they're out there. Now, to talk about this now, if my house is on fire and you're saying, hey, we want to make sure you have enough buckets to put that fire out before it spreads to other people's houses, I'm going to welcome all the buckets that you have and bring me larger buckets. But I would much rather, one, that we have fireproof material in our homes, and that there are already resources in place that if the fire, that we can take care of that immediately. And let's think about that at the same time that we're talking about grocery store workers and delivery drivers and healthcare workers. These people are essential, and the fact that we've not committed to making sure that they were safe and taken care of and in a position where they could breathe. And since we haven't done that, now we're in this disaster. And we've not prepared for it, and we're only in the early stages of this. We don't, what the worst of this is yet to come. And so what we want to make sure is that above all else, in all of the messaging and all of the work, and we need to make sure that every time Jessica talks about a resource that's available, that we're plugging people into that, and that every time that the governor and there are resources that are coming from the state that we're making sure they're getting to the right places. And when philanthropy said, here's this new book, we need to make sure that's happening. But we also need to make sure that we learn, if nothing else, that we blew it. And when we're ready, and when the pandemic hit, we were not ready because we did not invest in people and the security and the resilience of people prior to the event.
Thank you, Dr. Bay. You've taken off your professor hat and yeah, that's off. And you are really making an impact on social media, in the response to COVID. Can you talk about the initiative that the community conversation that you're trying to get to, and how you're trying to reach folks just from home?
So we're working with One Hood Media and Shasiri X and Black Women, Wise Women with Cheryl Ruffin, not Cheryl Ruffin, with
Cheryl
Hall Russell. I'm seeing Jessica Ruffin and I'm thinking of Cheryl Ruffin. Okay, different. Cheryl Hall Russell. We've committed, while we have the stay-at-home order, that we're going to do a Tuesday town hall every 2 o'clock, just to have a conversation with people who are doing work in these spaces to talk about what's happening in a very, very conversational style, that we can present this to folks in a language and in a space that they can weigh in, ask questions, contribute to the conversation, let us know what we need to be talking about so that we can bring folks on for next week. We've had 3 of those so far. Last week, we almost 20,000 people have participated and have watched the video since then. I haven't seen the numbers for this Tuesday's show. But the idea, the response has been that people appreciate that we're just here to talk about what's available, what's happening, what people are experiencing. We're trying to, let folks know where and how they can be tested. Trying to knock some of these myths and rumors down and get people to just take this seriously. And, I'm assuming based on the responses that we are making some impact. And, at this point, we have a pretty large audience from Philadelphia participating, when we look at the analytics of who's watching. And so it's resonating across the country. We've gotten a lot of folks from all over, but our Pittsburgh audience, people really appreciate it. We've centered this in what's happening in Allegheny County. What are the resources that are available? Who are we talking to? Where can people get help? And that's just with local faces and local conversations, it's just made it so just, like a living room conversation, from 7 or 8 different people's living rooms.
Thank you all for your comments. It's refreshing to have a candid conversation about what's happening right now in our community. I want to get into the Q&A so we have an opportunity to answer questions from listeners. Julie, if we can start with you and the task force, is there a plan to have a district-based representatives that can be a face in our communities?
That would be me. Hi. So yes, what our roles are on the task force, and like I said, you know, there's members from the governor's staff, there's members from the Department of Health, there's members from, you know, directors of the commissions, there's the folks in our office. Really how I would describe the outreach that's going to happen and what you're seeing, certainly will be coming a lot from the Lieutenant Governor's office. My role is Director of Western Pennsylvania, so that's all 26 counties of the West. So focusing on all of those 26 counties, anyone that has, you know, whether it's legislators, whether it's, you know, groups. I've been having conversations with the NAACP out here. We just did the PSC NAACP conference. They had a quarterly meeting, and both myself, my colleague Steve McFarland out in Philly, and Secretary Flood all joined to answer questions, to talk about the task force. What you'll be seeing in the next week is a lot of visibility, a lot of me being out in our community here, well, remotely, but on Zoom, but talking and having conversations with stakeholders. I've already had at least 20 conversations, ranging from community grassroots organizations, members of the community, constituents. I've been speaking with legislators, have had wonderful conversations with Representative Wheatley, Representative Gainey, about some of the initiatives that they've been working on. County Council Liv Bennett has been wonderful, and I'm looking forward to talking with her more. We have Summer Lee, we have Austin Davis out here. We have a wealth of knowledge, and people have been doing this work and figuring out what's working, what's not, and also who are the voices we need to be connecting to. So my information is actually on the Lieutenant Governor's website. So if there's anybody watching, they can feel free to reach out to me. We are an open and accessible office, so they can reach me at jgilliard@pa.gov. But you'll definitely see me, you know, on venues like this, and I'm so thrilled the Allegheny Conference did this, because I think it's important that we get the word out that this is even a thing, and making sure that we are all connected, whether it be the state level, you know, working folks at the county level here, working in the city, working in all of our individual communities, and all through Western Pennsylvania, and, you know, with our team, the entire Commonwealth, to let all of these comments and suggestions boil to the surface and see where the commonalities are, and then listen to what they have to say and report directly to the governor. These are the things that we should be looking at. Here's what we're hearing isn't working. And so the earlier point about, you know, communication, that's a big part of this, figuring out how we're going to communicate with everybody, and in a way that is relevant to their lives. So we've got experts for communications from, you know, DCD and the governor's office working with us, as well as our own press secretary who's joined in this initiative. And we are always open to feedback. I don't think we're ever going to see results if nobody says anything. So I'm really hoping when, you know, I'm reaching out or people are reaching out to me, that we're having a really substantive conversation that leads to actionable items. And I would expect some of those, what I would call triage issues, those immediate crisis needs, that's a real time acting on those things now. Some of these conversations pertain to the immediate. Some of these conversations will pertain to sort of our longer term goals for the Commonwealth. So again, continue to stay tuned, and feel free to reach out to me. And if you don't reach out to me, I'll probably be coming for you.
If only I could let you off the hook that fast. You know, Julie, we've talked about resources, we've talked about getting people in the community. Let's talk money. Does the task force help with any budget decisions, you know, policy to help, you know, spur more investment into our communities? Is that something that you could touch on for us?
What I could say is the recommendations that we will be making, we're not making decisions for the Commonwealth of Pennsylvania. You know, that's for our legislators, for the governor. What we are doing is providing another lens to say, possibly if you're looking for, you know, funding initiatives or so on and so forth, well, here's what this task force has highlighted as barriers or needs. That's how I would view this task force. We're not going to be individually reviewing or making recommendations, and certainly not at this time regarding any sort of budgetary issues. But I think that the material that we will come up with and the suggestions that we come up with in an organized way, having, you know, sort of pulled all of our collective heads together, and I don't just mean within the administration, I mean everybody at large. That is something that's tangible, and that not only our governor can take a look at, but our legislators are also watching to see how everything unfolds. And I'm looking forward to really informed conversations with our leadership, and hoping that when we put all of our heads together and we have a common goal, and we know that we've agreed that we need to tackle this and address this in a unique way. I am hopeful with doing all of that in a new and innovative way, and certainly with the leadership of our Lieutenant Governor, who I am humbled to be able to serve, and our governor, who I think is doing an incredible job, and not just because I work for the administration, I live here. My children are being raised here. My family is here. These things matter. This affects all of our lives. And I'm happy to be a part of creating new and innovative solutions.
Thank you. You know, we've talked about a variety of, excuse me, community efforts underway, but Jessica and Dr. Bay, can you talk about how the business community can continue to support community efforts?
Yeah, so I'll jump in. I'm just going to share one recommendation. I mean, I think that, you know, businesses, you know, are obviously paying close attention to the directives coming from the governor's office. I do think that, you know, one thing that folks are continuing to access are our businesses. And so if they can do whatever they can to post guidance or updates within their stores in multiple languages, I think that that would be amazing. While I completely understand the directive from Governor Wolf and under the guidance of Dr. Levine, who I also think is doing a fantastic job. I just want to uplift her hard work. That, you know, we need to be wearing masks in stores. And so when we heard that, you know, I think we all kind of personally went into our own, went to go look and see if we had masks. I know that Pinterest became my best friend very quickly on how he can get masks for my son and I. And my greatest fear was what's going to happen Monday morning if someone that maybe doesn't speak English or doesn't have the internet or is not on social media tries to go to the grocery store and is turned away. And so I do think that, you know, I would love to see businesses do a better job of posting this guidance and making sure that they can actually engage everyone and not operate under assumptions that people are getting information. So I will leave it there and I guess pitch it over to Dr. Bay and see if I'm sure you have much more to add.
Well, and so while those are all important immediate concerns and things that, you know, the businesses can do, I think another call to action is to evaluate, you know, your systems and your structures internally. And rather than a commitment to short-term stockholder performance, how do we think about investing long-term in the resiliency of the people who we're talking about? These vulnerable populations are vulnerable because we as a society have not committed to making sure that they are not. And so that means looking at who in your employee, who's not in your employee. Why do we have such disparate employment rates in these communities? And when you look at the job categories in your corporate structure, why are you missing whole populations in your corporate structure? What have you done to commit to a better overall society and to reduce the vulnerability? And it's not only one company's job. it's as a group. We all are responsible for each other. And if we want to think about long-term viability, long-term sustainability and resilience, it happens when we invest in people. When we don't, we're all more vulnerable because of that lack of earlier investment. And so now, because we have to, because so many people are at danger of overwhelming our system, our recovery is going to be that much slower. And we could have prevented this by investing earlier. And so the call to action is to making sure that you're rethinking how you're contributing to the vulnerability of so many people.
Yesterday, thank you for those comments, Dr. Bay. I think that's something that we all can sit down and reflect on. But yesterday, the Heinz Endowment and R.K. Mellon Foundation announced that they are launching $350,000 joint fund to specifically help the Black community. Can we just discuss and talk about the need for the targeted resources to ensure, there is equitable access across the board for all communities as we're recovering? So I just want to open that up for all of us just to kind of discuss. If anyone wants to jump in first, please. Dr. Bay?
Like you're ready, go for it.
Yeah, Dr. Bay, why don't you start us off?
I mean, I'm not going to say anything new. I'm going to say that, again, we appreciate all of the buckets of water that you're providing at this point. It's necessary because we have to put this fire out. Mm-hmm. But we really need to think about a long-term commitment to making sure that people are viable, that people can thrive. And longer investments, and so this is definitely welcome. And the Boys Foundation and Mark, I'm so proud of the work, and I know Mark, I'm so proud of that work that they do, and this is going to be impactful. But again, this is not going to be transformative, and that's what we need to be thinking about in the long term.
I think I agree with everything that Dr. Bay said. I just, I think that this is, all of the funds are extremely helpful, and we're seeing a lot of Black-led organizations that are, and not just Black-led, a lot of community-based organizations, but particularly Black-led organizations, for the context of this discussion, that are operating somewhat outside of their mission, trying to make sure that the folks that they serve are basically able to access like their critical life-sustaining needs. This is not, they're not doing financial literacy classes or making sure that people have food to put on their table in the evening. And so to Dr. Bay's point, any bucket of water is going to be helpful. Fully agree that we actually need that. We need to be hooked up to the hose, though. These are huge, systemic issues that just putting a Band-Aid on, it's not going to be sustaining. And so, I would love to see, this energy and this focus to continue beyond this pandemic. I also think, and I often talk about, really having, folks within the foundation community, and my boss is going to kill me, but taking an introspective look at even the way that they do their business, right? And so it's more around, how are you, what's the standard that you are creating? How are you, like, how accessible and inclusive are you being? There are some organizations with huge staffs. It's not a big deal to be able to, do quarterly grant reports and to write these really long, eloquent grant proposals and things like that. That's easy for some organizations. We need to recognize that there are some grassroots folks that are meeting very critical needs, and they don't have the capacity to be able to do that. And so, like, really being thoughtful around how we're actually determining need, and also how we're measuring impact is really, how we need to move out of this crisis, especially if we want to, again, hook up that hose to that bucket and make sure that any support that we're providing is something that's sustaining, and that, you know, folks are not going to always have to come back to that same well, that they will be self-sufficient. And, you know, as a Black community, I don't think that we've ever been in that space where we've been able to do that. We've certainly had easier times, but historically we've never not had to. So I think it's important to say that and to acknowledge that, and just, you know, to the point that both of my colleagues here have said, that like, this is, you know, I'm happy to be a part of these conversations, but like, this needs to be a new day. We need to start something new. We need to try something different.
I'm imagining a scenario where a narrative that came out of this could have read that as proud as a large grocery store chain could be for their ability to be able to contribute to a food bank, and in this time of need to be able to provide, you know, for a lot of folks who need that help right now. What if a different narrative would have been that that same grocery chain had so invested in its workers and shared the benefits of what they've been doing with their workers to this point that there were no losses and there were no cases in their grocery store? That their grocery store workers had the ability to, you know, support their families. They were taken care of. They had insurance. They had life insurance, possibly, where they weren't as vulnerable as they are now. And that investment was made prior to the pandemic. I think that's a much better story. That's the kind of story that inspires folks. And, you know, just across the board, we can all think about what could that corporate response be? You know, if I don't have workers, I don't have the engineers that I need, what if I partner with a local high school in one of these communities to make sure that, you know, we're working from the middle school and elementary school to expose children to these sorts of things? What's that new relationship look like? How do we challenge ourselves to be better corporate citizens?
Thank you. Thank you. A last question before I, you know, ask a couple, you know, closing from each of you, but just how can we as a community best work together on moving forward with equity? Who will lead, and how do we ensure, you know, it's sustainable?
I mean, I think I want to acknowledge, and I'm looking at the chat box, and there are a couple of, so everyone needs to lead. I think that, you know, I think that that's what's critical around this, that we need everyone to step up. And, you know, one very simple way that we can all step up and make sure that we have, you know, the appropriate level of resources directed in our community is, if you have not done so, please respond to the census. That's critical right now. And if you are over the age of 18 and able to register to vote, please register to vote. Please take the time to get an absentee ballot. I mean, we really need to be thoughtful about how we're uplifting our voices and how we're uplifting the need. And, you know, we need to move beyond, you know, the social media activism and really start to think about strategically around how do we get our message and how do we get our needs to the people that can actually make change with them. So I would be remiss to jump off this call without reminding folks that, you know, you need to respond to the census. It takes 5 minutes, and you need to either register to vote, and if you're registered, to get an absentee ballot so that you can participate in the primaries that are coming up in a few weeks. So,
I would just want to agree with everything Jessica just said. I also want to thank her for bringing up the census. Super important. Our second lady, sort of prior to COVID-19, had been actually hit the ground and was going out into the community talking with people about the importance of filling out the census. And that's something that you can do at home and fill it out. Again, also, you know, getting registered and voting is super important. And I think also understanding, you know, I think, yeah, and I've said this numerous times, Jessica has just said this, we need everybody focusing on this. This is not just going to be legislators working on it. It can't just be grassroots folks working on it and nobody else joining in the effort. We need funding. We need things to make all of these pieces start to gel together and we move forward. And I think also recognizing our own ability. within ourselves, our lived experience, our networks, our connections, all of those things. When we have, you know, when I'm thinking about someone who is in a crisis situation, asking them to be the ones to step up every time is, to me, problematic. It takes the support of everyone else around them to assist in making solutions that change all of our lives. If everybody's not okay, we're not okay. And that's to me the basis of all of this. It's going to take every single sector, all of our brains, all of our talents, and making sure to prioritize, again, the voices of the people that you're trying to assist. Hear what those needs are, respond to those needs, support what they are asking for in the best way possible. And I'm hoping that's what we'll see as we move forward through this. I'm looking forward to working with everybody. But, you know, be doing a deep dive while we're sitting at home now about what strategies can you come up with? What can you bring to the table to help?
And
In 15 seconds.
really, our CEO, Stephanie, you know, she's the co-chair for the Complete Count. So, you know, we appreciate all of you bringing up the importance of the census. Just wondering, Julie, where can we find the list of committee members, you know, that folks can be able to review and look at?
Yes, so as I said, we just formed, you know, and got all the final members of the committee. You should see something soon, and we will certainly be posting updates from the Lieutenant Governor's office. I encourage everyone to follow Governor Wolf and Lieutenant Governor Fetterman on your social media, because we're posting a lot of updates or what we're working on those pages. You should be seeing things being released about the task force and a lot more specifics, and particularly who the members are and what all of our roles are on this task force. So stay tuned for that in the next, you know, few days. We're not talking 2 weeks, but we, you know, need to get everything uploaded and all that information. You know, all of our sort of assignments and individual assignments were just being fleshed out. And so you'll be seeing that information shortly.
And Dr. Bay, I wanted to get to you for that last question as well. I know that we do have to wrap up here shortly, but is there any, you know, anything else that you
now is not the time to be shy. Let folks know what you need, and if you have something to give, and what we all do, step up, help out.
Oh, right. Well, you know, again, just as a you know, as a reminder, we have our website up at the Allegheny Conference to being able to see all of our resources and to the response of COVID. You know, if you need any other questions, or if there's anything from this webinar that you want to talk about or have a conversation about with us, please, you know, reach out via email, go to our homepage. We're going to get this webinar out, you know, and we'll just try to move forward. I'm sorry that we just got so caught up on time, but just to say, I'd like to also thank our sponsors, Peoples, Giant Eagle, Highmark, and UPMC Health Plan for their generous help through this programming. And I'd like to thank all of our panelists. Thank you, Julie, Jamil, and Jessica. You know, we appreciate your time today.
Thank you for the opportunity. We appreciate you.
Thank you all.
Thank you.
And please stay tuned for our upcoming webinars in the future.